What do I do if a client is allergic to Hyalase?
So really common question. Hyaluronidase has an allergy rate in the data of about 1 in 2,000. I suspect it'll be higher than that because if you actually do allergy tests for your elective reversals, you'll find it's more than 1 in 2,000. You have not just a little bit of redness, a little bit of erythema, but a distinctive reaction. I've certainly seen dozens over the 10 years I've been injecting. It is possible that you'll be allergic to it. Hyaluronidase is a protein, so people are more likely to react to protein. It's also not a protein that's made by the human body. It's actually normally, unfortunately, harvested from the testicles of goats. So you have to think that your body is likely to produce an antibody to that, certainly if you're repeatedly exposed to it. You will have people who are allergic. And then the question is, what do we do with those people? So the first thing, it depends on the circumstance. We have been using non-reversible products for decades. So if your patient is happy with that risk, and also importantly, if you are happy with that risk, then you could do the treatment knowing that you're not going to be able to reverse it. And if it doesn't work out for them, they'll have to wait for it to dissolve naturally, or that they risk complications that can't be treated, such as even a vascular occlusion. That's of course the thing we worry about the most. So the question is around the two risk tolerance. Firstly, you need to, as with all medical procedures, we need to justify the risk according to the well-being of the patient. So I would take that into account, and I have in the past done this with someone who has a really significant issue. It's easier if you know that you can remove that issue with a dermal filler treatment. It's easier to justify the risk because you can say this person is going to get a huge boost in well-being. But similarly, on the other end of the spectrum, you might argue, this is only a tiny little thing that you're not that bothered by. Why don't you not do this treatment and not take the risk? Because if something goes wrong, I can't treat you. So you're always weighing up that risk between the risk and the benefit. So what are you doing for your patient and what is the risk to them? And making sure that they own that decision, because it's not just okay that you own it, they need to own it. And of course, the other side of it is you're the one who's taking responsibility for this treatment. So I always say to clinicians, you need to own the risk yourself. Are you okay taking this risk? Because you're the one who's going to get the call and have to deal with it if there's a problem. And it is absolutely acceptable for everyone else in town to doing a treatment that you think is not worth the risk for you, for your well-being, for the amount of time you spend having to think and worry about it. So there is a decision to make for you about whether you would like to treat patients who you cannot use the reversing agent on, and to think carefully about that and then stick by it.